Hello, in today's video, I have a lot of practice test questions and answers to help you get ready for your mammography registry. This is like a mock registry exam because I have physics, anatomy, and patient care questions on here. For the mammography exam, if you are taking it with ARRT, there will be 115 questions plus those 30 unscored poly questions. So through the video, I will ask you different questions based on patient care, image production, procedures. If you want more of this type of video, just give the video a thumbs up for me, please. This will be part 1. All right, could you all please read this disclaimer that I have? So these practice test questions and answers are made to help you all pass your registry exam. Due to the registry's board's copyright law, these questions will not appear on your registry exam in this exact wording, but they are designed and constructed to test your knowledge in order to help you pass your registry exam. Since it takes time, effort, and research for me to make these questions for you all, I am going to read each question, answer choices, and the correct answer to avoid anyone from reusing my material and voice. If the audio bothers you, please mute the video. Being so, these questions are available to you for free. Could you please like, subscribe, and share the video? I would really appreciate it. Thank you all for watching and good luck on your registry exam. Please give the video a thumbs up or leave a comment if you would like part 2 to these questions and answers. This video will prepare you to pass your ARRT CQR assessment every 10 years or any National Mammography Registry boards. Okay, I just had to throw that disclaimer out there. All right, before I get into the questions, I want to give a special shout out. These two ladies, they passed their registry exam this month, July in 2025, and they reviewed my playlist. They looked at all of my videos. I know Elizabeth Sydney, she commented a lot under my video. She was very engaging. I like that about her because she will always come to my comment section and ask me to make new videos or say thank you for your videos. Trinity, I remember her too. I think she commented on my page some months ago before she was preparing for her registry, I believe. But yes, shout out to these ladies. And then I have 2 more who passed, and I'll give them a shout out at the end of the video. So whenever you do pass your registry, could you please come back to one of the mammography videos and just let me know, hey, I passed, and I can add you to the shout out board. All right, so with the Q&A, like I was saying, I like to read the question, the answer choices, and then I give you the correct answer. So here we go. For question 1, which of the following will be considered the most common benign circular oval lesion in breast imaging? Is it fibroadenoma, Paget's disease, phylloid tumors, or microcalcifications? Okay, just a few more seconds and I'll give you the answer. Okay, the correct answer is fibroadenoma. Fibroadenomas and cysts are the most common circular oval lesions. Phylloid tumors are a rare type of breast tumor that originate in the breast connective tissue known as the stroma. Phylloid tumors can be benign, which is non-cancerous, or malignant, which is cancerous, because they can have characteristics of both. Question 2. The American Cancer Society, or ACS, recommends clinical breast examinations every blank years between ages 20 and 39 years old. Is it 6 months, 1 year, 2 years, or 3 years? All right, about to give you the answer in just a moment. And if I'm going too fast, you can always pause the video or you can rewind it. Okay, the correct answer is 3 years. The American Cancer Society, ACS, recommends clinical breast examinations every 3 years for women between ages 20 and 39, and annual CBE for women starting at age 40. Question 3. Which of the following recommends that screening mammogram begins at ages 50 to 74 years old? Is it the American College of Obstetricians and Gynecologists, American Cancer Society, American College of Radiology, or U.S. Preventive Services Task Force? Correct answer is the U.S. Preventive Services Task Force. They recommend that screening mammograms to begin at ages 50 to 74 years old, but they do not recommend screening mammograms for ages 75 and older. So if you look at the picture above me, that's the Mammography Registry review video that I already have for patient care. It go into further details regarding patient care, the organizations and guidelines who recommends when this should start or when this should end. If you watch that video, it goes into a lot of great information. Just go to my Mammography Registry Review playlist to find it. But it's very helpful. If you want to click on that, you can pause it, you can come back to that video, but I will recommend you all to watch that one. All right, so the comparisons for ACS and the USPSTF guidelines for ACS, American Cancer Society, you have the mammograms to begin yearly. So whenever it is time for them to start their mammogram, which is at age 40, they want them to continue yearly and continue as long as the woman is in good health. For USPSTF, the one that we were just talking about, the mammograms is every 2 years for them. Whenever they start having it at age 50, it's going to end at age 75. So after age 74, this organization does not recommend for a patient to have um, mammogram. So you probably will get a lot of questions. Patients is going to ask you some point in your career, what age should I stop getting them? So the company I work for, they go by they're with ACR, so they go by as long as the patient is in good health and expected to live at least 10 years or longer. So they're going by that. Pretty much what ACS recommends, as long as the lady is in good health, keep coming in. But you will get that question. I get it all the time. I actually just got it 2 days ago as well. All right, if you made it this far in the video, could you please leave a comment? Let me know where you're watching from. I just like to do this on my page, and it's just good to know that there are still people going for mammography. What state or country has a lot of job openings for mammotechs? So I do have people watching from Houston, from Georgia, from Maryland, from Florida, California, Arizona. I think I have a few people watching from California, a couple of people watching from Houston, and this is just something that I just like to do. So if you don't mind leaving a comment, you can just say I'm watching from, and you can say your state or country. All right, so question 4. Which of the following does not recommend breast self-examinations or clinical breast examinations? Is it American College of Obstetricians and Gynecologists, American Cancer Society, American College of Radiology, or U.S. Preventive Services Task Force? Okay. The correct answer is the U.S. Preventive Services Task Force. So they recommends that screening mammograms to begin at ages 50 to 74 years old, but they do not recommend screening mammograms for ages 75 and older. Also, breast self-examinations or clinical breast examinations is not recommended. For question 5, which of the following is defined by the half value layer? Is it anode, cathode, filtration, or filament? All right, just a few more seconds. Okay, the correct answer is filtration. Filtration helps reduce exposure time and patient motion artifacts. It is used to shape the X-ray beam. Question 6, the minimum half value layer should not measure less than, is it zero point 0.10 millimeters of aluminum, 0.15 millimeters aluminum, 0.20 millimeters aluminum, 0.30 millimeters aluminum? Okay, just a few more seconds. The correct answer is 0.30 millimeters aluminum. So at 30 kVp, the half value layer should not measure less than 0.30 millimeters aluminum. For question 7, which of the following is most often used material in the X-rays tubes window and as a filter to optimize the X-ray beam? Is it beryllium, molybdenum, rhodium, or tungsten? Just a few more seconds. Okay, the correct answer is beryllium. This is the most commonly used because a regular glass window would cause hardening to the emergent beam. This will eliminate the low photons that is needed. It's primarily used in the X-ray tubes window as a filter to optimize the X-ray beam for breast imaging. Question 8, which of the following is the area where the electrons strike on the target? Is it the anode, the cathode, focal spot, or filament? Just a few more seconds. Okay, the correct answer is focal spot. Okay, if you are finding this video helpful, please like, share, and subscribe for more videos. Question 10, which radiology specialty is gadolinium-based contrast used to help image the breast tissue for better visualization of breast tumors? Is it breast MRI, breast ultrasound, contrast enhanced mammography, or stereotactic biopsy? Okay, just a few more seconds. The correct answer is breast MRI. Gadolinium is a contrast enhancement material that is used in breast MRI to help enhance the visibility of breast tissue, such as abnormal breast tumors. It also improves the contrast between different tissues on the images. So I work in MRI as well. I have my license or certification for MRI, and we do a lot of breast MRI exams whenever patients have dense breast tissue and they're alternating between mammography and breast MRI, or if they have like a personal history of breast cancer, if they have any problems with their implant, if they were just diagnosed with breast cancer, um, different reasons why, or if they're at high risk for breast cancer, is like different reasons why they would come to have a breast MRI exam done. Question 11. Which term is used to describe how many times a woman has given birth to a vital fetus at least 20 weeks gestation? Is it multipary, nulliparity, parity, or primipara? Okay, just a few more seconds. All right, the correct answer is parity. Parity is used to describe a pregnancy that has made it to at least 20 weeks of gestation. So if you all can let me know in the comment box, which one of these categories do you think would be your problem area for the registry? So do you need more help on physics, patient care, or anatomy? Which one do you think that you're nervous about will probably give you more trouble? All right, question 12. Which term is used to describe a woman that has never given birth? Is it multipary, nulliparity, parity, or primipara? All right, just a few more seconds. The correct answer is nulliparity. So this would actually be whenever you are charting, they like to know how many kids like a woman has had. Did they breastfeed? What age did they have the first child? What age did they have the last child? If they had more than one children, did they have kids before 30? Did they have kids after 30 years? All of this like is within the woman's breast risk factors to determine their chances of possibly getting breast cancer in the future. Of course, they want you to encourage breastfeeding and to have kids before age 30 if you can. Question 13. Which breast pathology is microcalcifications are associated with? Is it ductal carcinoma in situ, invasive lobular carcinoma in situ, or papillary carcinoma? All right, just a few more seconds. The correct answer is ductal carcinoma in situ. Question 14. Which breast cancer is confined and does not invade the duct walls? Is it ductal carcinoma in situ, invasive lobular carcinoma in situ, or papillary carcinoma? Okay, the correct answer is ductal carcinoma in situ. This is a type of breast cancer that is confined to the duct and does not invade the duct walls. Okay, question 15. Which breast cancer accounts for 22% to 23% of non-palpable breast tumors that are detected with the mammography machine? Is it ductal carcinoma in situ, invasive lobular carcinoma in situ, or papillary carcinoma? All right, just a few more seconds. Okay, the correct answer is ductal carcinoma in situ. Question 16. Which term is used to describe the boiling off of outer shell electrons of the filament atoms? Is it beam hardening, half value layer, filtration, or thermionic emission? All right, just a few more seconds. All right, the correct answer is thermionic emission. Question 17. Which target material is not used in mammography? Is it copper, molybdenum, rhodium, or tungsten? Okay, the correct answer is copper. So copper is not used in mammography, but you have molybdenum, rhodium, and tungsten that is used in mammography. For question 18, which material is the evacuated X-ray tube made of? Is it copper, Pyrex glass, steel, or wood? Just a few more seconds. Okay, the correct answer is Pyrex glass. Question 19. Which radiation occurs when an inner shell electron is removed by an incoming electron? Is it Bremsstrahlung radiation, characteristic radiation, Compton radiation, or ionizing radiation? Okay, the correct answer is characteristics radiation. So characteristics radiation is also known as photoelectric radiation. You may remember these terms from X-ray physics. So this refers to the photons emitted when electrons transition between energy levels within an atom. This occurs after an inner shell electron is ejected by an incoming electron. Question 20. Which radiation will change its course and lose energy when it is slowed down? Is it Bremsstrahlung radiation, characteristic radiation, Compton radiation, or ionizing radiation? Okay, the correct answer is Bremsstrahlung radiation. This is also known as breaking radiation. It's an electromagnetic radiation that is produced when a charged particle, which is usually an electron, is decelerated or deflected by another charged particle. This is most commonly an atomic nucleus. All right. So if you don't mind, just leave a comment. Let me know if you are looking to work in a hospital or outpatient imaging clinic whenever you pass your registry, or do you already have a job lined up? Some people are studying this and they already are working in mammo, and then I have some who is a student who is using this to prepare and they haven't found a job. So just let me know in the comment box, which type of facility would you rather work in, a hospital or outpatient imaging clinic? And if you have questions about um, how both of them work, leave me a comment and I will make a separate video on the difference between working in an outpatient imaging clinic versus working in a hospital as a mammo tech. Question 21. Which of the following is the most important molecule in the human body? Is it carbohydrates, DNA, lipids, or hydrogen? All right, the correct answer is DNA. So this is important for the human body because it contains the genetic information for each cell. Question 22. Which of the following is considered the most radiosensitive tissue? Is it the heart, mature cells, muscle, or stem cells? All right. The correct answer is stem cells. Your stem cells are the cells with the potential to develop into many different types of cells in the body. They serve as a repair system for the body. Do you all remember stem cells from radiobiology, from X-ray? That was like my favorite subject in X-ray school was the radiobiology, so I remember it, but just let me know in the comment box if you remember the most sensitive, the less sensitive cells, the most sensitive organs, less sensitive organs, and I can try to incorporate more questions on those topics. Question 23, which of the following is considered the least radiosensitive tissue? Is it cells in the gastrointestinal tract, developing embryo or fetus, your heart, or reproductive cells? Okay, the correct answer is the heart. Question 24. Which of the following involves an incident X-ray that ejects an outer shell electron from an atom? Is it coherent scattering, Compton's effect, pair production, or photoelectric effect? Okay, okay, the correct answer is Compton's effect. This involves an outer shell electron. The incident X-ray is ejected from the outer shell electron from the atom. The incident X-ray will change its path with reduced energy. Question 25. Which X-ray interaction involves the interaction between an incident X-ray and an inner shell or K-shell electron of an atom? Is it coherent scattering, Compton's effect, pair production, or photoelectric effect? Okay, the correct answer is photoelectric effect. Question 26. Which X-ray interaction involves the interaction of a very low energy X-ray with an atom? Is it coherent scattering, Compton's effect, pair production, or photoelectric effect? Okay, the correct answer is coherent scattering. This is also known as classical scattering. So you may find the answer as coherent or classical. Just know that both of these is known as the same thing. Question 27. Which X-ray interaction involves an X-ray at energies greater than 1.02 MeV or MeV? Is it coherent scattering, Compton's effect, pair production, or photoelectric effect? Okay, the correct answer is pair production. Pair production involves high-energy X-rays that interact with the nucleus of an atom. These X-ray energies are greater than 1.02 MeV. This type of X-ray interaction is not a concern in diagnostic radiology. Question 28. Which X-ray interaction involves high-energy X-rays in the region of 10 MeV? Is it coherent scattering, pair production, photodisintegration, or photoelectric effect? All right, the correct answer is photodisintegration. This is a nuclear reaction where an atomic nucleus absorbs a high energy gamma ray or photon and then promptly releases a subatomic particle, effectively breaking the nucleus apart. Question 29. Spiculated borders are a strong indication for asymmetric breast tissue, benign tumors, dense breast tissue, or malignancy. Malignancy. Question 30. Benign breast lesions are, is it circumscribed, irregular, multiple lobulated, or spiculated? Okay, the correct answer is circumscribed. Circumscribed is a characteristic that describes benign breast lesions. These lesions are circular or oval and are considered fibroadenomas and cysts. Irregular, multiple lobulated, and spiculated are characteristics for malignant lesions. All right, so don't forget that the Compton's effect and photoelectric effects are the two most important interactions that occurs in diagnostic imaging for radiology. All right, so that's it for this video. Thank you all for watching. Please give the video a thumbs up or leave a comment box or leave a comment in the comment box if you found it to be helpful. These are all of the ladies that have came back to my video and let me know that they passed their registry. So congratulations to them. Shout out to them. I know the ones that's closer to my side of the screen, close to the thumbs up part, they passed their registry in May of 2025 and June of 2025. The ladies at the top, Trinity, Drew, and Elizabeth, they just recently passed theirs this month in July of 2025. So thank you all for watching. I will say that the ladies closer to the thumbs up, the two ladies, Argelia and Amanda, they did not even have half of the videos that I have now. So they still pass with less videos than I already have on my page. I think they mainly looked at my playlist videos that I was telling you about that's 1 hour long. I'll link the playlist in the description box so you can go through all of the videos because I have X-ray, MRI, CT, daily vlogs. I have everything going on my page. But anyway, thank you all for watching and I hope you enjoyed this video. Please like, share, and subscribe for more videos. Bye.